Good afternoon. Welcome to the School of Public Health Fall 2023 Doctor of Public Health Commencement and Hooding Ceremony. This is an especially important commencement as we are in the midst of celebrating our 10th year of the School of Public Health. I'm incredibly proud of everything that we've accomplished together over the past 10 years since public health was established as a standalone school within the university. That was back in 2013. Since its first cohort of graduate certificate students in 2002, public health at Georgia State has grown substantially, with a network today of over 2,000 alumni serving their communities through research, education, and practice at public health institutions and agencies, nationally and internationally. The School of Public Health was recently ranked by the U.S. News and World Report among the nation's top 25 schools of public health among public institutions. The school's growing national profile is a testament to the diverse talent, dedication, and conviction that we share as a school community in our collective mission to advance health equity locally, nationally, and around the globe. Today we're recognizing and celebrating the accomplishments of 3 DrPH graduates, Daniel D. Driffin, Jessica Franks, and Jasmine Rockwell Hurd. I extend my heartfelt congratulations to you, our class of 2023. With this degree, you've really chosen to deepen your engagement and commitment to the vitally important field of public health. I would argue that health is the foundation on which all else sits. We are not alone in appreciating the value of health. There is an African proverb that states, health is wealth. Winston Churchill is quoted as having said, healthy citizens are the greatest asset any country can have. Seneca, the Roman philosopher, noted that, quote, health is the soul that animates all the enjoyments of life, which fade and are tasteless without it. Well said, Seneca. Finally, Hippocrates reduces the topic to its simplest form by noting that, quote, health is the greatest of human blessings, end quote. Yet as a society, we undervalue and underinvest in the things that make us well. We know that for many, health is not valued until sickness comes. The burden of disease in our country is overwhelming. The disparities and inequities are startling. Collectively, they represent true suffering among actual people, families, and communities. But the unsatisfactory state of health in our nation need not be taken as given. It should serve as a call to action. We started this academic program because we recognize that if we as a school are to maximize our impact on population health and health inequities, we need to train leaders like each of you, who bring passion and who, as David Satcher has said, care enough, know enough, do enough, and who will persist until the job is done. Graduates, with the completion of your degree, you've doubled down on your commitment to this worthy and honorable work. You've raised your hand and you said, I'm all in. I want to thank you for all you've done and all you will do as your careers go forward from here. As you continue your professional journey to advance public health and health equity, remember that you're part of a larger community of leaders making the case for health as a priority and ready to take action to improve the nation's health. As a former runner myself, I'll use a running metaphor here by saying that this work is a marathon. It's not a sprint. Be sure to avail yourself of the resources needed to run a long race. Bring the right equipment, tools, and methods. Much of that you've learned in the DrPH program. Feed yourself with the latest evidence. New knowledge is always being developed. Obtain it, use it to better navigate the course and the ever-changing terrain. Encourage and help each other. The race is long. Sometimes you or your colleagues would need encouragement and support, so help one another. And last but my favorite was to run with confidence and optimism. That is, believe in yourself and what you're doing. There's no substitute for confidence and expectancy. With that, you can run from the front and set the pace. Graduates, you're ready for this race, so step to the line with hope and belief for what is possible. You are ready. Congratulations, wishing you the very best. At this time, I'd like to invite Dr. Harry Hyman, Director of the DrPH program, to the podium. Please welcome Dr. Hyman.
Thank you, Dr. Lynn. Good afternoon. So, as director of the DrPH program, it's both my honor and privilege to participate in today's commencement and celebrate our 3 program graduates. Daniel, Jessica, and Jasmine today represents an incredible milestone. As you join the growing group of GSU DrPH graduates, it's amazing to see so many of your friends, colleagues, faculty, and family members who've shown up for you today, both in person and via the live stream. And together with them, we're extremely proud of your accomplishments. As reflected in Dean Lynn's comments, the School of Public Health's overarching mission is to be a premier urban school of public health dedicated to advancing health equity. As the 3 of you especially understand, preparing the next generation of public health leaders and champions for health equity is a charge our DrPH program takes seriously. And I say that the 3 of you especially understand this because each of you so profoundly reflect this intention and the hope and promise inherent in our mission. Each of you are already public health leaders meaningfully engaged in the work of advancing health equity. Daniel, you and I first met when we were both at Morehouse School of Medicine. You were completing your MPH while already having launched Thrive SS, a community-based organization focused on building community and achieving health equity for Black, same-gender loving men. This was just one of many organizations you helped lead. Before starting our DrPH program, you had already received the Dan Bradley Humanitarian Award from the Human Rights Campaign, the Alan Thornell Political Advancement Award from Georgia Equality, among others. But it was not your many honors and accolades that endeared you to your fellow students, faculty, and colleagues. It was your humility, your sense of purpose, and your unrelenting commitment to improving the lives of sexual minority men and shifting power to help ensure that public health policies and practices were meaningfully informed by community voices and perspectives. Your dissertation did just that. Using qualitative methods, you captured the voices of Black sexual minority men in the HIV workforce to advance our collective understanding of their experiences with HIV seroconversion. Through this work, you identified powerful opportunities to inform both policy and practice. Jessica, we met when you were a Georgia Len Fellow. For those unfamiliar with the acronym, LEN stands for Leadership Education in Neurodevelopmental and Related Disabilities. Don't try to say it 3 or 4 times fast. It's a 1-year interdisciplinary training program based in the School of Public Health's Center for Leadership and Disability. It was clear when you started the DrPH program that you would be a critical partner in ensuring that our class discussions were inclusive of the needs of people living with disabilities. After starting the DrPH program, you moved fittingly to CDC's Office of Minority Health and Health Equity, and now the Office of Health Equity, where you serve as a health communications specialist. Over the course of your DrPH studies, you were able to present at APHA on urban transportation equity for people with disabilities and work with state-level policy and advocacy organization to identify housing barriers for Georgians with developmental disabilities. Your dissertation used qualitative methods to assess the accessibility of public health emergency information on federal websites for people with intellectual and developmental disabilities. This, no surprise, included powerful recommendations for improvements through policy, process, and practice. Last but not least, Jasmine, in a public health world where we are searching for ways to move upstream, you are a powerful example of how to do the critical work needed where people live, work, learn, play, and age. After getting your MPH at the esteemed Georgia State University, you worked as a data coordinator for Veteran Support Services at United Way. From there to the Office of Homeless and Special Needs Housing at the Georgia Department of Community Affairs, and then to Senior Project Manager and now Senior Grants Manager for Partners for Home. Partners for Home is the lead organization funded by the Department of Housing and Urban Development, HUD for those who know, and others to end homelessness in the city of Atlanta. For your dissertation, you used community-based participatory approaches to collaborate with and capture the voices of unhoused youth. Your research identified their needs as well as the gaps and barriers in currently available services and supports. This has powerful implications for practices and policies, not only in Atlanta, but also nationally. Needless to say, there are many challenges ahead for public health and for our quest to achieve health equity. But today, I'm feeling hopeful. And I'm feeling hopeful because it is clear that these three graduates, these three public health leaders especially, are cause for hope. They truly reflect the leadership that we need to make a difference, to move the needle, and to help ensure a more just and equitable future for everyone. To the three of you, as you continue your journeys, I know you will continue to have careers filled with meaning and fueled by your passions to make a difference. I urge you to be bold, to continue to take risks, and to quote Daniel, to be relentless, courageous, and fearless. Congratulations again to each of you and your families. It's now my pleasure to call on Daniel and Jessica, you have to wait your turn, Sophia, to share some of their reflections.
Thank you, Dr. Hyman. And I also want to acknowledge, I'm not a JD, you notice I'm wearing purple, but there is a law student somewhere today graduating with a tiny head, wearing a salmon-colored robe. Anyway, so I believe we all have a story, we all deserve good health, and we all have the power to create change. I wrote this 5 years ago in the purpose statement that I submitted to apply for this program. I usually cringe when I read things that I've written in the past, but I think this statement still holds true. Although I change, we all deserve just good health, to we all deserve the opportunity to attain our highest level of health, which is the definition of health equity. I went on to explain in my statement that the field of public health is where I found a way to create that change and ultimately make an impact on the health and well-being of others, particularly that of people with intellectual and developmental disabilities, which was my research area of focus. For me, being in this program was about more than getting another degree, although I admit it's pretty cool hearing people say Dr. Franks. I'm so grateful for this opportunity to learn from and grow with so many amazing colleagues and faculty as I continue to find my identity as a public health leader. Hearing people along the way tell me, yes, you can go back and get your doctorate. Yes, you can get through biostatistics. Yes, you can have a baby in the middle of grad school. Yes, you can finish this dissertation, helped me to believe in myself and promise that I'll always say the same to my daughter for all of that and more. Thinking back on my experience in this program, the first thing that came to mind was, wow, what an interesting time to be in a public health graduate program, as we abruptly found ourselves in the midst of a global pandemic, many of us working on the COVID response at public health agencies during the day while navigating in real time how to apply the same public health guidance that we were putting out in the evenings by social distancing in the classroom and eventually engaging through our Zoom screens. We learned a lot from COVID, and from 2020 onward, the combination of a global pandemic, the devastating impact of COVID on communities of color and other marginalized groups, and social justice protests raised voices that may have been silenced in the past. So I believe one of the greatest challenges ahead of us in the field of public health is ensuring that the lessons learned from these historic moments are not forgotten, and continuing to lift up those voices and prevent them from ever being silenced again. Not only that, but that we continue to actively apply those lessons learned to strengthen, invest in, and maintain the integrity of our public health infrastructure. As leaders in public health, we play a major role in this effort, but so does everyone else in this room. Because health is influenced by many complex factors and how those interact, including individual behaviors, personal behaviors, and environmental conditions, it requires a collective effort to protect our health, and that's essentially public health. Within the public health field, we're seeing somewhat of a paradigm shift in our approaches. An emphasis on identifying the important role of structural and systemic factors that affect our health has moved from a narrow focus on individual behaviors. And with this, we're recognizing the importance of and applying cross-sector collaboration. This also means implementing public health programs in a way that's becoming more culturally responsive to the diverse communities that we serve. And from a public health communications perspective, where I sit, this might look like reframing our approach to communicate health equity not only as something that affects all of us, but also as something that's achievable. We often communicate about health disparities in ways that may lead people to believe that inequities only affect people other than themselves. But we're starting to see the importance of identifying shared values and leveraging empathy among different audiences to effectively break down the us versus them mentality, and instead convey health equity as a we issue. With this interconnectedness, we have the ability to either destigmatize or further perpetuate health disparities. The COVID-19 pandemic was proof of this and showed how inequities can weaken our society. I think we're at a pivotal moment in pushing forward the health equity movement. Although we haven't reached the point of achieving true health equity, and may not do so in my lifetime, I truly believe we're moving the needle closer. And public health leadership must be at the forefront of advocating for policies that address these social determinants of health, while leading the way for all of us to confront critical issues that influence our health, including structural and systemic racism, economic inequalities, and health disparities. I'm going to wrap it up with a quote from a public health champion, particularly mental health, the late Rosalind Carter. She said, "A leader takes people where they want to go. A great leader takes people where they don't necessarily want to go, but ought to be." With that, and given that public health affects all of us and we all have a role to play in achieving health equity, I say to everyone here, both my public health and non-public health colleagues, let's take every opportunity that's ahead of us, knowing that our collective efforts today will shape the health and well-being of my baby girl over there and future generations where they ought to be tomorrow. Thank you, and I had to move this part to the end so I would make it through everything else. But I want to dedicate this achievement to my mom. She was my biggest cheerleader throughout this whole process, and the decades before that. We lost her to breast cancer in October. About a month before I defended my dissertation. And I know she has some form of glass of champagne in hand up there right now. So I say cheers to my fellow graduates, and cheers to all of you for being here supporting us. So thank you.
I wanted to start an organization to save my life. If whales, snails, dogs, cats, Chrysler, and Nixon can be saved, certainly the lives of black men are priceless and worth saving. From pre-K to about 3 weeks ago, I estimate that I've been a student for 6,645 days. Yeah, yeah, 6,000 days. According to my mother, um, I've dreamed of becoming a doctor since around the age of 6, and that journey has been checked off. This dream would indeed be deferred without countless teachers, administrators, professors, lunchroom ladies, and the occasional lunchroom man, all the people that I call family, friends, and most importantly, my colleagues across the classrooms that sat with me. To be honest, I have a few of those days, especially in epi methods 2 and environmental and occupational epi, of sitting there with that Britney Spears meme of pure confusion and when did we learn this? Being accepted and completing the DrPH program here at Georgia State, we collectively called ourselves the pandemic cohort. And over the last 3 years, it has been an extreme pleasure pursuing a doctoral degree during the global pandemic through WebEx and Zoom. I wouldn't recommend it, but we managed to get by somehow. The 2022 survey of earned doctorates collected by the National Science Foundation reports 57,596 individuals received doctorates from a U.S. university. Black and African Americans were 2.67. That's 1,540 individuals. Let it sit for a minute. This number has significantly increased over the last 2 decades from a mere 728. That's 1.3% of those with a doctorate degree. Looks like this. Increasing the number of Black or African Americans securing a Doctor of Public Health from Georgia State University is a growth opportunity. As one of 2 Black men who've completed this program thus far, the School of Public Health must continue to invest in innovative strategies to increase racial and certainly sexually minority men. I know the brain power across this DrPH cohort at Georgia State University is the definition and embodiment of diversity, equity, and inclusion. Each of us not only bring our lived expertise and ability to re-engineer systems, but we hold the opportunity to continue to adapt racial inclusion of all populations to ensure equity is achieved and, most importantly, maintained. I am excited and cannot wait for the innovative and people-centered solutions that Dr. Rockwell Hurd will propose as she decrease the negative impact of housing instability for young people, older adults, and people living with HIV across Atlanta and our region. I hold the same faith as Dr. Franks, who continuously improve communication across our technological platforms for all people, especially those with different abilities. I would not hesitate to say we are graduating from the best Doctor of Public Health program for working adults and adults who maintain a social calendar in medallion status. Georgia State University School of Public Health will continue to mint health equity warriors as our world become a healthier and more secure places for all. Thank you so very much.
Oh man, I just want to thank you for those remarks, moving remarks, and opening and sharing your hearts. It's really, really moving. Thank you. At this time, I think you all came to get some degrees, so will the DrPH graduates please stand? By the virtue of the authority delegated to me by the President of Georgia State University and the authority vested in the President by the Board of Regents of the University System of Georgia, I hereby confer upon you and each of you the degree described in the official record of these commencement proceedings with all the rights, privileges, and responsibilities thereunto appertaining. You may move your tassel to the left. Congratulations. At this time, let me invite Denise Gavea to the stage to announce the degree recipients.
Thank you, Dr. Lynn, and good afternoon, everyone. This is the time to individually recognize this year's graduates. Graduates, if you will proceed to the stage as directed to be hooded, we will proceed with the reading of your names. Each graduate will approach the stage with their dissertation chair, who will perform the hooding. So let's get started. Dr. Daniel D. Driffin. Dr. Jessica Franks. Dr. Jasmine Rockwell Hurd. Congratulations again to all of our graduates.
Let's give our graduates one more round of applause. This is truly a day of recognition and celebration. In addition to joining over 2,000 public health alumni, you join a network of over 285,000 Georgia State University graduates. You and your loved ones supporting you along the way should be abundantly proud of your many accomplishments. Graduates, you are now poised to make even greater contributions to the urgent work of advancing health equity across our nation and across the world. May you go forward with purpose, with confidence, and with a deep commitment to the critical work of improving the public's health. On behalf of the School of Public Health faculty and staff, congratulations. We're adjourned.